Hi, my name is Angel Rivero, and right now I am with the Dr. Virgilio Novero Jr. He was the past president of the PSRM. He is the current chair of the ART Regulatory Board, and he is the only Filipino board member of two Asian fertility societies. It is an honor, Doc, to have you today. I'm sure we will learn so many things from you.
Happy to be here.
Okay, Doc. So first of all, let's talk about why you thought of pursuing this specialization of fertility.
I really wanted to enter fertility through male infertility. That means that I wanted to be a urologist. But in our class, there were two guys who were ahead of me in the ranking in class, so I knew I wouldn't get into urology. So I thought I'd enter it through female infertility.
I see. But then I think that also turned out to be a more colorful kind of field.
Yes. It was the time of our high school when the first IVF baby was announced.
Wow.
And it stuck to me then that I wanted to enter into a field related to fertility because of that first IVF baby. And it stuck to my mind until I got to medical school.
Imagine that. So back then you witnessed the announcement of the first IVF baby, and now you are a doctor. How much has changed from then until now?
So much. The techniques in 1978, 79 are far different from now. Even from the time of my training in 94, 95, I hardly used anything that I learned then with what I'm doing now.
Oh my gosh, so super talagang nag-high-tech na.
Yes.
Does that mean that the success rate has also vastly improved?
Yes, there were times that pregnancy rates were only 5 to 10% in the early days. And by the time I finished training, it was about 30%. Now it's somewhere between 50 to 60%.
Wow. And this is the difference palang in the statistics, no, about the success rate. But what naman about the difference in the perception of Filipinos about the whole idea of IVF and getting fertility treatments?
I think Filipinos are getting more open-minded about what needs to be done. Before, the general perception was they had to be conservative. They were very conservative, but now they're a bit more open-minded, probably because of globalization of everything right now.
I think so too. So let's talk about the different treatments available as of this age, Doc. So if someone came to you and then they wanted to take the conservative route muna, what are we looking at? What kind of treatments?
Probably it's not really just trying the patient's wanted, but really depends on what the patient needs.
Okay.
So when a patient comes in, we evaluate what they are, and if they really need the conservative because that's the right way, that's the correct way of treating them, they would be given the conservative approach, meaning could be timing, could be natural intercourse, could be just plain and simple ovulation induction medication followed by natural intercourse for a couple of months. And however, there are certain patients that would qualify for a little bit more advanced treatment. So there's no decahon treatment for this. They would be treated and they would be evaluated and treated as to what they need to receive.
And when you say advanced treatment, Doc, hindi naman ibig sabihin IVF na kaagad.
Yes. Well, the more advanced treatment, in terms of advanced treatment, would be already the intrauterine insemination, IUI.
I see.
Yep.
And the price point naman, Doc, should couples already save up for something like this because it will involve a considerable amount of money?
Yeah, again, depending on the treatment which we will be recommending. We haven't even talked about surgery. Certain kinds of problems will require surgery. So again, depending on the complexity of the procedure, there can be those that can be handled fairly more easily, but others will require a little bit more resources to complete.
I see. From your experience, Doc, mas marami ba ang nasosolve na infertility cases by just siguro going through the first few layers of trying to fix the problem, or most of them talaga go all the way into more complex things?
By statistics and by my experience, it's really like 50%. So half will benefit from conservative treatment, but also the other half will eventually need some form of advanced treatment.
I see. Ngayon, Doc, di ba, syempre, nasa Pilipinas tayo. So, marami tayong mga beliefs, katulad ng pagsasayaw sa ubando and pag-aalay ng mga bagay for fertility. Do you think there is some sort of psychological aspect that makes it become more real?
Pilipino ako so I'd like to keep my perceptions very open. And I allow them to do what they want as long as it doesn't interfere with the Western medical concepts that we have regarding fertility treatment. Fine, do it. In fact, I encourage them to do it. It will make them feel free. In fact, in my clinic, I collect various infertility icons.
No way!
Yes, and I collect them from all over the Philippines and around the world. And they're there, and when patients look at them and they ask, what are those? Sabi ko, those are fertility icons. If you're not doing anything and my treatment's not working, I can rent them to you.
Okay, I see how that can be rather uplifting, Doc.
Yes, that's right.
So, last question po is, how do you see the emotional burden on the patients playing a role in the success of their journey?
Yes, you really have to tell your patients, we have to tell our patients that they should be as prepared emotionally and psychologically when they undergo treatment. Studies have shown that in couples where the husband is supportive, that the wife is positive, and positive in her outlook for everything, and if she's always smiling and feels very light during the whole treatment, they would be more successful than the group where the husband is not supportive, the wife is always whining, and she's always in pain and complaining.
Oh, no.
So they really have to have a positive outlook in the whole process, and they should probably have already an enhanced chance for success.
Right, kasi counterproductive pa rin
Yes.
ang pangit na attitude.
Yes.
All right. Thank you very much, Doc.
Okay, thank you also.